So our next speaker is Dr. Rigved Tadwalkar. Dr. Tadwalkar dazzled us a few years back with an amazing talk on wearable technologies and the heart. Ever since then, he has been sought after to speak at national meetings to continue educating us on this exciting topic. When not learning about all things technology and the heart, he is busy on social media, Twitter, as well as helping Pacific Heart Institute build our brand online. Please help me give a warm welcome to Dr. Tadwalkar.
Thank you. So, in previous years, I've discussed, wearable devices, and what's interesting about this field is that every year something new happens, or we have to learn more about where we're going. So what I tried to do in this talk today is try to distill it down to what you need to know today in 2022. So starting off here, I have no specific disclosures, but I will be talking about commercial products. So pretty straightforward outline. We're going to try to be as linear as possible. So we're going to talk about what wearables are, where have we come, where are we going, what are some popular wearables, and then within that discussion of popular wearables, we'll talk about some key data that you might want to know from a cardiac standpoint, and then the clinical uses of this. So wearables, for those of you who are not aware, are smart electronic devices that can be incorporated into clothing or worn on the body as implants or accessories. So the two that you know of today are smartwatches and fitness trackers. Those are the ones that are most prominent. But talking about the watch, because that's where all the focus is, the watch dates back to about the 1500s from a gentleman named Peter Henle, who was a locksmith and clockmaker in Nuremberg, Germany, who's often considered the inventor of the first watch. And as you know, back then, watches were mostly worn as pendants, or they were attached to clothing. And of course, watches have come a far way since then, but it really wasn't until the 1960s that we saw some iterations. So originally, there was a mechanical mechanism, clockwork, oscillating balance wheel, sort of the traditional watch. And then in the 60s, then we had this vibrating quartz crystal and a battery-powered watch, which were the quartz watches. It wasn't until the 2010s or so that we had smartwatches, where these are computer-like devices that are designed to be worn on the wrist. And really what distinguishes smartwatches specifically is that timekeeping is only a small subset of the smartwatch's overall abilities. But you can't have a talk about these smartwatches and these wearables without talking about sensors. So once you understand the concept of these sensors being a part and parcel of these wearables, it's a lot easier to understand what all these different devices are. So I'll talk about a few of these just because they're so important. So the microcontroller there on the upper left is like a mini computer. The pedometer you're all aware of, step count. Photoplethysmography comes up all the time. We abbreviate this as PPG. We'll talk a little bit more about this, but this looks as a differential light absorption to determine heart rate. Electrocardiogram, obviously looking at the electrical recording of the heart, and oscillometry now, which is basically like blood pressure recording. But you have a whole number of other things as well. The accelerometer, the gyroscope, looking at angular motion. Oximetry now is the big fad. We'll touch on that because that's what the newest iteration of the Apple Watch discusses or touches on. Pressure sensors, etc. And this is actually a review recently from Lancet. It's a little bit of a busy slide, but I just want to point out the different colors here, the different categories. So up at the top, you have activity-based sensors, like we discussed, your GPS, accelerometer, your pedometer. You have your biometric sensors, which is what everyone's interested in these days. That's like the PPG, heart rate, EKG functions. And then there's also biochemical sensors, and I'm going to give a good example of that in just a moment. So what are some recent wearables in medicine? Just so you have an idea, like where does this go? We always think about the consumer side, but what about within medicine? So there on the left side in prevention, there is this device it's an example of a device, there's many like it. It's called the Caretaker, which allows us to check all 5 vital signs in one device. In the middle, in diabetes, some of you may even have this, you have a Freestyle Libre, which is basically a patch that is worn with a filament that inserts itself into the interstitial area of the skin to continuously sample the glucose. And then on the GI side, you have the Medtronic Smart Pill, which is essentially a pill that is swallowed that allows us to diagnose GI disorders by looking at things like pH, transit time, etc. But what about cardiology? So this slide might seem kind of funny for those of you who practice cardiology, but we are already familiar with this concept of wearables within cardiology. We just have to sort of reframe how we look at this. So we have already been using these technologies within cardiology for some time. And I do want to point out specifically the electrophysiology realm, which we have ambulatory monitoring. Many of you have maybe come into a cardiologist's office to get a patch monitor, which essentially is a wearable. Some of you who are having rhythm issues and we can't really quite figure them out with just a patch monitor might get a loop recorder, which is essentially implanted and is technically a wearable. And even on the treatment side, pacemakers, implantable cardioverter defibrillators, these are all technically wearables, although they are implanted devices that are done in a surgical or semi-surgical setting. And even on the interventional side, the stents, valves, right? These are all foreign materials that are essentially inserted and sort of worn, so to say. But kind of zooming back into the consumer side, and we'll bridge all this together, but basically in 2022, now that we're here, where are we going? Where are things going? So based on a report from CCS Insights, which is a consumer research firm, in September of 2021, when they last looked at this, what they found basically is that wearable sales have boomed during the pandemic, and smartwatches are now the dominant force in wearables. And just to give you an idea of how big this market has become, we can look at worldwide shipment. So comparing 2016 to now in 2022, or what's expected in terms of shipment, we're expected to have twice as many fitness trackers shipped and 5 times as many smartwatches. So you can see how this is a growing segment. But what are people using these wearables for? So what's interesting is that the vast majority of individuals are using these wearables for well-being sorts of uses. So there's steps and step count. There is EKG, heart rate. Some of you are probably using it for these reasons. Sports tracking for those of you who are sort of want to have some sort of fitness data. And then much lower on the list are things that are basically an extension of the cell phone. So like contactless payments, calling up your voice assistant just to make things more convenient. But to see that people are so interested in the prevention side is actually very telling. Some popular wearable brands, many of you already know of these, some of you already have their products. Obviously Apple and Fitbit are big ones, especially in the cardiovascular space. But a couple I actually want to point out there as well are Xiaomi and Huawei, which are Chinese brands, which are huge in the Chinese market. So we think of these brands as global, but there are certain sectors or certain brands that are big in certain sectors and countries. And the list goes on, of course. If you look at the top 5 wearable device companies by shipment volume, a couple of key trends that I want to note. Apple has about 30% of the market share globally. And then this company number 5, which you may not have heard of, Imagine Marketing, which actually is an Indian company that goes by the brand Boat, sells fashionable consumer electronics like headphones, earphones, wearables. They've had a 200% year-for-year growth. So this is a company you may potentially hear of at some point down the line. So I say all this to sort of bring the following point together, which is that now you have a convergence of worlds. You have the healthcare side where you've had doctors for years in their silo evaluating patients, determining the diagnostics, their treatment strategy, and essentially everything fell to the physician. And now you have the consumer world, especially accelerated during the global pandemic, where people are now collecting their own data, they're trying to make sense of their own data, and now they're going online and trying to figure out what to do with that data. So the physician of the future is going to have to bridge these worlds, and I would argue a successful doctor is going to be able to bridge this in a way that we have not yet really done. So the second part of this talk, I want to talk about popular wearables and the data sort of that drives them and where things go and where we are. So in terms of cardiac wearables, and of course these devices do more than just things that are specifically cardiac, I do want to talk about 3 separate devices because these are things that people use all the time and we hear about from patients that come to our office. So one of those is the Fitbit, one is the Kardia, many of you may actually have this, and then of course the Apple Watch, which is ubiquitous. There are also wellness wearables. These are newer, and there's more than just these, but I just sort of point these two out to highlight them, and we'll talk about them at the end of the discussion because they look at more than just sort of the traditional variables. And one of the things that distinguishes them, or at least purportedly, is that they're looking at sleep patterns as well. So we'll start with Fitbit. So Fitbit I like to start with because they're probably one of the first brands to really have a wearable device that was popular for consumers. And basically Fitbit makes wireless wearable fitness monitors and activity trackers. That's what they do. Their first product was in 2009, and popular products now, over 10 years later, are the Fitbit Sense, Versa 3, the Charge 5, and you name it. But Fitbit's entire strategy is predicated on a couple of things, especially initially. So one is resting heart rate, and the other is step count. So I want to go into some of the data behind why a company like Fitbit would try to exploit, I guess, this, to sort of, bring to consumers. So what is the whole point of resting heart rate? So I want to start with this, which is a 2014 journal American Heart Association article looking at a Framingham population. And essentially what they wanted to look at was the association between the baseline heart rate and fatal and non-fatal outcome during 2 decades of follow-up. They looked at 4,000 plus Framingham participants and followed them for cardiovascular disease. And what they saw ultimately was that a higher baseline heart rate was associated with an increased cardiovascular disease rate. And you can see those hazard ratios for each of these different endpoints. Heart failure, all-cause mortality, cardiovascular mortality, all were increased with a higher baseline heart rate. And what was interesting is that when they did the analysis, there was no lower threshold beyond which the benefit of a lower heart rate had abated. So lower heart rates, better. And if you actually look at all these individuals and put them into quartiles, those in the lowest quartile of heart rate had the lowest events. And you can see those lines continuing to diverge up to 20 years of follow-up. What about step count? Step count, as you know, is sort of the modern-day pedometer. There's a digital construction now. It's not like the analog sliding ball that we used to have. They're made of micro-electromechanical systems. Try to say that 3 times. And what about step count? I'm just going to highlight a couple of studies just to show you why step count is important or why we feel it's important. One is the Navigator study in 2013. This looked at 9,000 plus individuals with impaired glucose tolerance and with existing cardiovascular disease or a risk factor for cardiovascular disease if they were a little bit older, recruited them from a number of different countries and then followed them up for cardiovascular events. Their ambulatory activity was assessed by a pedometer at baseline and then at 12 months. And what they saw essentially is that for every 2,000 steps per day, there was a hazard ratio of 0.92. Another way of saying that is that an increase in the number of steps was inversely associated with the risk of a cardiovascular event. And both the baseline levels of daily ambulatory activity and the change in ambulatory activity decrease the subsequent risk of a cardiac event. So steps are good. Similarly, in 2015, in this cohort study from Australia, in over 2,500 individuals, they looked at their daily step activity with pedometer at baseline, and then 90% of these patients were followed over 10 years. And they saw that a higher daily step count was at baseline linearly associated with a lower all-cause mortality. And even more interesting is when they did the analysis is that if you increase your daily steps from sedentary, like you're not doing much, you're just on the couch all day, or maybe the pandemic got you down, and you were able to increase that to 10,000 steps per day somehow, you were found to have a 46% lower risk of mortality over a decade of follow-up. That's almost 50%, rivals some of the best medical therapies that we potentially have. So then the question becomes, if this is all good, we're doing steps, looking at resting heart rate, does the Fitbit actually work to make somebody fit, right? That's really what we want to get to at the end of it. And what's interesting is that when looking at the literature, systemic reviews suggest that that's not really the case, or at least we haven't really proven it for sure. And I'm just going to talk about 2 studies that sort of delve into this. So if the Fitbit itself hasn't really been quite there in terms of saying, hey, we're making these huge impact in terms of heart outcomes, despite data suggesting that looking at these things and trying to promote them should help, then what is? So when you add interventions with Fitbit, we have seen some positive data. So the first point I want to make about this is that randomized control data suggests that things like texting, gamification, social or financial incentives can actually promote physical activity. So in this specific study of about 150 full-time sedentary office workers, they took them and then randomized them to a Fitbit or a Fitbit plus a program called MapTrek. Essentially, it's like a program that gamifies the experience. So, in this instance, you compete against your colleagues, and you're able to see a leaderboard in terms of who's doing the most steps and whatnot. And what they saw is that in this Fitbit plus MapTrek group with the app, basically there was a significant increase in daily steps to over 2,000 more steps per day and more active minutes, about 11 active minutes more. But despite this, as you see in these curves, the activity went down over a period of time. And so yes, the overall activity was improved when you add the app, but the steps for both groups went down over time. And this is what I'm going to foreshadow with the next thing that I want to mention, which is that the randomized control data does not show, despite the fact that you can promote this, it doesn't show any long-term behavioral change or improvement in outcomes. So the long-term is not quite there. And I'm going to highlight this one randomized control trial called the TRIPA study, looked at 800 employees in Singapore and randomly assigned them to 4 different groups for 6 months. So they looked at a control arm, a Fitbit arm, Fitbit plus a charity incentive, Fitbit plus a cash incentive, which you would think is going to be the best, right? And then they looked at MVPA, that's moderate to vigorous physical activity, so you just sort of equate that to physical activity, and health outcomes at the 6-month period while they had the intervention, and then at 12 months, once the intervention was gone after those 6 months. And here's what they found. At 6 months, they saw that the Fitbit group had 16 additional physical activity minutes per week. You had the charity group with 21 additional minutes, and then the cash group did the best, right? You're going to give somebody cash to exercise, it's going to work the best, right? But here's the thing. So look at that blue line up top. After those incentives disappeared, the cash group probably dropped the most, right? And it was only the Fitbit and Fitbit plus charity group that actually were able to remain somewhat consistent. But you can see all of those sort of dropped over time, but they were able to stay the most consistent. But you can make whatever you want out of this data. But the one thing that I want to highlight about this study, and really is kind of like the bottom line behind a device like the Fitbit, is that there's no evidence ultimately of any significant improvement in any actual health outcome, hard health outcome. So weight, blood pressure, quality of life, they didn't sustain over a period of time. So basically my conclusion about this in reference to Fitbit is that it doesn't mean you shouldn't get one. It's just that if you have one, it shouldn't be your entire strategy. It's basically one part of an entire fitness strategy in order to make yourself more fit. So far, I just kind of want to step back for a second. We've talked about commercial heart rate monitoring, and that's where we're talking about Fitbit, things like Polar for you fitness enthusiasts who like chest straps and want to see what's going on with your heart rate. Now I want to shift gears into heart rhythm monitoring. So we're going to talk about the rhythm. And of course, one of the first products that looked at this is the Kardia, and many of you may have this device. It's basically a rectangular device, and what it does is it basically converts electrical impulses from a user's fingertips and transmits them into the ultrasound signals that is used by the mobile device's microphone to create an EKG. And the way that it actually does this is proprietary. They don't give you the exact details. But this received FDA approval in 2014 as a single lead cardiac event monitor. And so there's been a whole host of studies, but here's one specifically that looked at validating the AliveCor Kardia for atrial fibrillation screening. And basically what they saw is that in a selected community level population of about 200 individuals, that you can screen for atrial fibrillation with high sensitivity, specificity, and overall accuracy. There's been a number of trials on the Kardia and how it can be used in a clinical setting. I just want to highlight one called the a-fib trial. And this showed that with a single lead ECG monitor, in this case the AliveCor Kardia, that you can improve outpatient arrhythmia detection in patients who present to the ER with symptoms, but no cause. Like you come in with, hey, I'm feeling lightheaded or I'm having palpitations, but we can't really figure it out in the ER. And really what they showed is that by using the AliveCor Cardia as opposed to standard of care, that they were able to capture an ECG during symptoms over 5-fold to more than 55% at 90 days. So basically they're saying, hey, this could be sort of used as a bridge until you see your physician to capture an EKG with some sort of symptoms, whether it's atrial fibrillation or sinus tachycardia or whatever it may be. And so basically there's been a number of sort of ways that this can be used to sort of bridge your healthcare until you can see your physician. Now, the Cardia, just so you're aware, does have a 6-lead device, and you might wonder, well, how does this work? Is this going to be like a bunch of leads on my body, or how does it exactly function? But basically, it's the same device, but there is a third pole, and essentially, that third pole is sort of made up of your knee or basically your ankle to create these 3 usual leads to basically complete Einthoven's triangle and make 3 different leads and 3 different virtual leads. And the purported advantage here is that now you're able to detect more than atrial fibrillation alone. So something that you may see, in fact, it is available at the moment. Shifting gears a bit, we'll talk about the Apple Watch. Of course, many of you have an Apple Watch, incorporates fitness tracking, health-oriented capabilities, wireless capabilities, has its own operating system, all the bells and whistles. But really, ultimately, the strategy that Apple has taken behind their watch is they've sort of decided or predicated this on the fact that screening for atrial fibrillation, the most common sustained arrhythmia worldwide, is of some sort of value. Right? So they're saying that, hey, like we need to look for atrial fibrillation in a population because people are being affected. And so I put potential in italics on purpose because this is still a debate in terms of how much do we need to screen and to what degree and what does that mean for clinical outcomes. So I do want to point to this one JAMA study called the mSTOPS trial. This is from the Scripps cohort in San Diego. They looked at 2,600 plus individuals who were randomized to active monitoring with a self-applied continuous ECG patch. And they found that they had a higher rate of atrial fibrillation diagnosis at 4 months and a greater initiation of anticoagulants. However, there was increased healthcare utilization at 1 year, so you can say, is that good or bad? But importantly, no difference in atrial fibrillation-related emergency department visits or hospitalizations. So it's like, what are we doing this for is the question. And so I'm going to jump back to this in a moment, but just so you're aware, the Apple Watch was validated in a large study in the New England Journal of Medicine a couple of years ago. And the bottom line with this study is that among participants who received a notification of an irregular pulse with an Apple Watch, 34% had atrial fibrillation on a subsequent EKG, and 84% of those notifications where you may have a-fib were ultimately concordant with real atrial fibrillation. So there is actually pretty good accuracy in reference to the Apple Watch. But now the interest is, from a diagnostic standpoint, is how do we improve that accuracy? So this study from China that looked at 100 plus individuals looked at when you can combine technologies from the mobile phone with a PPG algorithm, which is part of how Apple detects atrial fibrillation, you can actually improve detection to over 94% as compared to the gold standard EKG. A study out of UCSF that was a proof of concept study looked at using PPG with a deep neural network. This is a form of artificial intelligence, and they found that they could passively detect atrial fibrillation better when using artificial intelligence algorithms, except that there was some loss of sensitivity and specificity when people are sort of going about their activities because of noise from sort of just day-to-day things. So it works best when people are at rest. So the next phase of this is outcomes. This is what I was referring to. And the Heartline study, which is now enrolling, will basically investigate the effects of a-fib screening using PPG and EKG together and look at clinical outcomes. To give just a broader overview of this, just a couple of trials and things that you should be aware of at this point, has less to do with wearables per se, but just atrial fibrillation detection and treatment in general, is one, the Loop study, which looked for atrial fibrillation with a loop recorder, again, those implanted devices, and then initiated blood thinning, anticoagulation for episodes greater than 6 minutes, and they found that despite this, you would think this is all great, it did not reduce the risk of stroke or systemic arterial embolism compared with standard of care. But on the other hand, Stroke Stop, a study that came out at around the same time, which looked for atrial fibrillation using 2 daily EKGs for 2 weeks and treated those that had a-fib, did show a small decrease in the overall cardiovascular endpoints. So this is something that we're not quite sure. It's like, how much do we look for atrial fibrillation? When do we initiate anticoagulation? How do we treat it? Does every atrial fibrillation episode mean that we need to sort of go full court press? These are all questions that need to be answered, and hopefully we'll have an idea of within the next couple of years. So I briefly want to just talk about other applications of these EKG technologies. One is hyperkalemia, and for those of you who are not aware, this means high potassium. For those of us in the cardiology community, we know that high potassium can lead to characteristic EKG changes. And so, of course, these companies are very interested in studying this, and so AliveCor specifically looked at a large cohort of patients from the Mayo Clinic over about almost 30 years. They had 700,000 plus patients and basically looked at their EKGs and their potassium values and essentially created an artificial intelligence algorithm and applied that to the AliveCor Cardia. And ultimately what they saw is that with the Cardia device, based on how the EKG ST segments look, that this device is able to capture whether or determine if someone has high potassium in their bloodstream with a 94% sensitivity and 74% specificity. So this is still in testing, but this might be another potential use to sort of look at other things than just heart rhythm monitoring. What about acute coronary syndrome? This is a big one. So basically, everyone wants to know, can my Apple Watch detect a heart attack? Right? That's always the big question. I want to know if I'm having a heart attack. And we're far from prime time with this. But this was like a proof in concept study from the Annals of Internal Medicine in 2020, which showed that basically, if you take the crown of the Apple Watch and put it in characteristic spots around the chest, you can actually look at those ST segments and determine whether someone is having a form of heart attack. And yeah, which is really interesting. Now, of course, it's not advised for you to go do, right? But they actually saw quite a bit of concordance. So if you look at the top right screen there, this is a patient. So there's basically 3 there. There's the standard. There's someone with a type 2 heart attack, also known as an NSTEMI, and then a STEMI, and then which is the classic heart attack. And when you sort of compare the Apple sort of ECG leads with a standard EKG, you can see that there's quite a bit of concordance there. And so, of course, how do you integrate this in a real product? I think that remains to be seen. But maybe there will be a day where we can detect these subtle changes and determine if someone is in fact having a heart attack. So that's going to be a big thing when it does happen. So I'm just going to talk about 2 other things to finish out the talk. One is just recent developments with the Apple Watch, and then I'll talk about those other wearables. The biggest thing that the new Apple Watch purports itself as having is oximetry, ability to detect blood oxygen. What you need to know about this is that it uses the same sort of PPG, photoplethysmography, and reflectance to determine levels of oxygen, so reflectance along the bloodstream, to determine the level of oxygen within the blood. But what this has shown is that because of the variability of this, increased ambient light, the pressure applied, positional variation, all of these things affect how well this works as compared to a standard fingertip pulse oximeter, which we use in the clinical setting. I've had a patient tell me, like my Apple Watch tells me my oxygen saturation is 72%. Should I be worried? And I'd say, if your oxygen saturation is 72%, you would not be breathing. you would not be so comfortable right now. Yeah. So there's definitely a way to go here. Other wearables. So just briefly want to talk about this just so you're aware of what's on the market. One is the Oura Ring. This is something that's become popular. That detects an arterial pulse in the finger. And then this is just more kind of their advertising bravado, but they say that their PPG or photoplethysmography reaches deeper. There is a temperature sensor for whatever that's worth. And then they have a, quote, highly sensitive accelerometer. And it creates 3 scores, a readiness score, a sleep score, and an activity score. And what they're looking at really is a set of daytime measurements, which are similar to what you're getting from like a Fitbit or an Apple Watch, and then nighttime measurements, which are basically sleep sort of guided parameters that they're trying to obtain by looking at, again, different types of sensors and trying to sort of make sense of how these sensors sort of change. The Oura Ring has some very popular consumers, so I just wanted to point out Prince Harry has one, and a number of other celebrities love to sort of show off their Oura Ring. But looking at the aura compared to polysomnography, this is our gold standard for sleep, right? So compared to polysomnography, actigraphy, which is basically the way that these rings and devices determine sleep, was shown to have high sensitivity, ability to detect sleep, but low specificity, ability to detect wakefulness. And there's a wide range of accuracy because it's just one sensor. And the type of information you get from a polysomnogram is a lot more deep. You look at sleep stage composition and a number of other parameters which are fundamental in studying sleep. So it's not really quite there in terms of prime time. And ultimately, the ring accurately detected light and deep sleep on 65% of occasions and 51% of occasions, respectively. 50% is like a coin toss, right? It's like you might as well just toss a coin, and you hopefully you land on the right, on heads or tails. So, okay. Lastly, the Whoop strap. Whoop strap is, a lot of athletes will use this. There's no display, collects a bunch of data and sends it to your phone so that you can have that phone data analyzed, and looks at a number of metrics: sleep, strain, recovery. This purports itself as being of value as well, this device, because there's a lifestyle community. You sign up to be part of the community. And basically, to determine strain, it looks at the maximum heart rate and uses that number to establish a personal heart rate zone, and then basically monitors the duration of time you spend in that zone to calculate the strain. And from a recovery perspective, it looks at heart rate variability, respiratory rate, sleep metrics, et cetera. Bottom line with the Whoop strap is that in terms of validating it for sleep, there's a couple of small studies that they looked at. They found that the Whoop strap overestimated sleep time by 8 minutes plus or minus 33 minutes. So, basically a huge variability, right? But they said it was, non-significant, quote unquote. And when you compare it to 2-stage sleep, which is easy, wakefulness and sleepiness, versus 4-stage sleep, where the kind that we're used to in clinical medicine, slow wave sleep, REM sleep, et cetera, we found that for simple 2-stage categorization, it was somewhat accurate, somewhere in that 80 to 90% range. But when it came to real sleep metrics, 4-stage sleep, it was much poorer, somewhere in the 60 to 70% range. So, obviously this is going to continue to get refined over the years. We're just not quite there. So if you get or collect sleep data off some of these applications, you can't really rely on it as being really the gold standard. So I wouldn't read too much into it when it comes to this. And that's basically what I have for you today. These are my social handles if you want to find me on social media. And thank you for giving me the time. I appreciate it.